Welcome. My name is Peter Strong. I specialize in mindfulness therapy for the treatment of anxiety, depression, addiction, and also for working with traumatic memories and PTSD. So I'm often asked, what's the best approach for overcoming traumatic memories and managing PTSD? Preferably without the use of medications. My answer is that I really recommend that you work with a therapist who is experienced with working with trauma and one that really understands the structure of trauma, how it actually works in the mind. I find that mindfulness therapy is one of the best approaches for working with PTSD because it does just that. It looks at the actual structure of those traumatic memories, how they work, and it looks at the patterns of reactive emotions that typically arise around the traumatic memory, whatever those emotions may be, such as anger, depression, anxiety, guilt, shame, you name it. There are many different kinds of emotional reactions that develop in reaction to that emotional energy that's stored up in the trauma. So that's what I mean by the structure of your trauma. We need to look at the actual memory imagery itself, and we need to look at these patterns of habitual emotional reactivity that really feed that traumatic memory and stop it from healing. So working with imagery, let's talk about that a little bit. So really we need to understand that trauma is simply emotional energy that the mind is not able to process, it's not able to digest it and assimilate that emotional energy. And what happens is that it becomes tightly associated with the memory image itself. The image is what triggers the trauma. Remembering the site of an accident, or if it's in a war scene, then it might be the death of a comrade, or if it's even closer to home, it might be the trauma associated with childbirth, or the trauma associated with having a medical procedure, or even grief is a form of trauma. It's very difficult for the mind to process that intense emotional energy. And when it gets stuck, when it's unable to process it, then it constellates around this imagery. So this is the source of flashbacks, for example, that many soldiers experience when they return from the battlefield. It's the imagery that causes the trauma. That's the important thing to understand here. So during mindfulness therapy, we work on exploring this imagery, looking at its structure in detail, and then exploring how to change that imagery to help it reprocess and become digested and assimilated so that it no longer triggers emotional trauma. There are certain characteristics we always look for in emotional trauma, in the imagery, and that is the size of the imagery and how close it is in our visual field. When we remember it, how large is it and how close is it? Typically with a flashback, it's so large that we are basically reliving the scene. We are in the image, and that's what really stimulates that emotional trauma. It causes you to relive the event as if it was happening right now. So seeing that is really important. So the first thing we focus on is trying to create some distance, if you like, between you and the memory image. We do this by developing your position as the observer, looking at the image, to break that habit of reactive identification, which is the technical term for what happens in a flashback, where you literally collapse into the picture and you become the picture or part of the picture. That's reactive identification. We lose our perspective and we become dominated by the memory image. So we need to train ourselves to be able to maintain our separate position as the observer. And we do this by the process of mindfulness meditation, where we are literally meditating on that traumatic memory image. But now we're doing it consciously, on our terms, and that brings a dramatically different result and outcome. We train with it, we learn to sit with it, we watch how we react to it. If we start to collapse into the image, then we watch that, we see it clearly, and we stop it before it takes effect. We start to manipulate the structure of the memory image too. For example, make it smaller. It's quite remarkable how much relief you can get by simply taking that memory image and making it really small, making it the size of a grain of sand, and taking that memory image and then placing it somewhere that feels right. It might be to place it on the floor, it might be to place it on a beach with other grains of sand. These kind of simple ways of working with the memory imagery can be very, very powerful indeed. And they basically retrain the emotion to heal itself, because when trauma does heal, it does so by changing its own imagery. So that's a natural process at work. And during our meditation sessions, we are actually learning to speed up this process of change in the imagery. That's how emotions heal. They become smaller. So we explore the imagery, we explore making it smaller, we explore moving it further away, so there's more separation between you as the observer and the memory image. We might explore changing the color of the image, so intense traumatic imagery has intense color. And again, you can produce quite remarkable changes by actually reducing the intensity of the color. You can turn down the color. When you are conscious, when you're actually observing it instead of reacting to it or becoming identified with it, you can then actually start to change it. And the more that you change the imagery, the more that it heals. There are lots and lots of different ways of working with the imagery. Then the second part of working with PTSD is reprocessing the emotional reactions. Now, many of them will also change when you can reprocess the trauma itself, because those emotional reactions are feeding off the traumatic emotion itself. That is the fuel that feeds the emotional reactions of fear, of depression, of guilt, of shame, or whatever it might be, or helplessness. So that's one thing. But the second thing we can do is take this active role yet again and meditate on those emotions themselves and look at their imagery and help that imagery change. Again, the same process. When the imagery changes, the emotion changes. It will happen naturally over time for most people. The imagery becomes smaller, etc. It becomes more faded. It loses a lot of its detail, its color. Its size becomes significantly smaller. In meditation work with mindfulness, we are actually simply speeding up this process of healing. So that's a brief description of how we can work with PTSD. So if you're looking for someone to work with to help you overcome your PTSD, I invite you to contact me and tell me more about yourself and your particular struggles. Ask any questions you have about mindfulness therapy and how this can help you with your specific needs. And when you feel ready, we can schedule an online therapy session via Skype. So being able to work via Skype is very popular. It's more convenient and it's very comfortable for many people. It's less clinical in nature, so we don't pursue clinical treatment in online therapy. What we do is we work on changing and healing the underlying process that produces your PTSD symptoms. So if you'd like to learn more, please contact me and let's schedule a session. Typically, you'll see quite big changes within 3 to 4 sessions once you start applying the mindfulness techniques that I will be teaching you during these sessions. It's a very, very interesting and effective way of working with emotional trauma. And I look forward to meeting you and helping you. So please contact me if you would like to get started with online therapy for your PTSD. Thank you.